This lecture gives you some basic information about how to design and conduct a focus group. First of all, what is a focus group? I said a little bit in the survey lecture, but it's basically a small group of people who gather together to discuss their perceptions, attitudes, beliefs, and opinions about a topic. The idea behind focus groups was created by the sociologist Robert Merton to measure the popularity of radio programs for advertisers. The advertisers wanted to make sure that the radio programs were paying enough money to them, if they were really popular. So he got people together, and that's actually a picture of Merton on there, and he asked people to focus on what they liked. And the focus group was born. It's used often still in marketing, but it's used in qualitative research as well. Merton's kind of an interesting character. He was known for certainly a lot more than the focus group. He often said he wished he got royalties for creating the focus group, which he didn't. But he coined other words like unintended consequences and self-fulfilling prophecy. So he's got a whole lexicon that he developed. Focus groups are one way to find out, first of all, if your list of domains, remember those big concepts that make up your general goal for your survey, if they really reflect what's on people's mind. So say you want to educate people about AIDS. Well, kind of in your clinical head, you might be thinking AIDS is a virus. I need to make sure people understand that. When you do a focus group, you realize they want practical information. What can I do to avoid getting AIDS? So it helps you understand what's in their heads, and this is incredibly important for thinking about how to design questions for your survey. It also tells you if you've missed any important domains. I gave the example of the survey, the course evaluation survey, where they didn't ask about social interaction. But here's another one for men with BPH. Doctors often asked, how often do you urinate at night? And they get their answer, and then they'd prescribe treatment based on how often they urinated. Really what was most important, though, was how much these symptoms bothered the men. So asking how bothered are you by gave a whole other dimension to thinking about how do you treat people. The focus groups also can help you see if you've missed any specific aspects of a domain. Steve Voloshin and Lisa Schwartz did a study in JAMA several years ago about attitudes towards mammography screening. And they asked, one of their domains was the harms of mammography, and they thought that people would be really worried about false positives and the problems of those. When they talked to people, they found that women were most concerned about the radiation from the mammography. It wasn't really something that had been on their radar screen within this domain at all. And finally, in general, focus groups really are a way to help you understand how the people that you want to survey put the facts together, so how they think things work. You may have one idea of what happens when a patient comes into your clinic and the process they go through to see a doctor or to have a treatment. But it may be very different in the patient's mind than it is in your mind. And focus groups really can help you understand those things. So to sum it up, there's two main reasons to have focus groups. The first is to get the concepts and ideas right for your survey. Learn what people care about and how they think. And even if you find a canned survey for something, a validated survey, it might still be worth doing a focus group to see if people have thoughts that weren't in the previously validated survey. You'll learn a lot, and they're kind of fun. You can also use focus groups to pre-test your interview or your questions. Just sit down with people, give them your questions, and ask what they think. Are you using the right language? Do they understand it? It's really a case where this little bit of prevention helps a lot in terms of making sure you don't make mistakes down the road. So how do you do it? Well, you have to invite people from your target audience and figure out the best way to get to those people. What's important, though, is you're not looking for a statistically representative sample. You want lots of different opinions. You want different people to come together so that you get the wide range of things that people are thinking about. It doesn't mean that any new idea ends up as a domain on your survey, but if many, many people reference the same thing, like they all say, oh, we're concerned about radiation and mammography, then you know that you're onto something that probably you should include in your survey. On the other hand, it's helpful, especially if you have a sensitive topic, that you have the groups themselves be a little bit homogeneous, because people are often more comfortable speaking openly about with people that are more like themselves. So it's sort of a balance. You can do more than one focus group, but balancing this diversity of views with people who you think will be comfortable talking to each other. The right number of people is about 6 to 8, and you'll see different numbers and you look at different things, but you really want enough people so that you can have a good conversation, but not so many people that you can't hear from everybody. So 6 to 8 is kind of a sweet spot. You also have to figure out how you're going to do it, the environment. It should be convenient. It might mean taking your focus group to where people are rather than waiting for them to come to you. I'll tell you that often you'll get 6 or 8 people who say, oh yeah, I'm going to come to your focus group. And then when it's time, they don't show up. It's helpful to do reminders, call people, maybe overbook a little bit, because it's very common for people not to show up for these. But you want to create a safe environment that's non-judgmental. Limit the amount of time that you're taking, people's time that you're taking, and tell them. So if you tell them this is a 90-minute focus group or 60-minute focus group, honor that time. And you also want to make sure that you have some way of keeping track of the information. So it's great to do a recording. It can be helpful to have note takers also. In fact, you might want to bring somebody else with you in the room to take notes. I've had the misfortune of having a recorder go bad on me at the end of I realized at the end of a focus group that my microphone wasn't on, and I sit in my car furiously and take notes. You don't want to be in that position because you can't recapture the information. So just try to have a fail-safe system. Oh, it doesn't hurt, by the way, to serve food. That's kind of standard. Give money or gift cards if you can, and pay for things like parking. Just do whatever you can to make it easy for people to participate in this activity. As a moderator, you really need to be kind of all things, a sensitive diplomat so that you can encourage people who are shy and who might not want to speak. One way you could do this is to start out with a first question and then hear from everybody in the room. That way everybody speaks right at the beginning, and that might encourage people later. Restrain the garrulous. If people are talking too much, you need to move away from them. And it's fine to say things like, that's a wonderful point, Susan. I'd be happy to talk to you about that when we're finished, but for now I'd like to turn the conversation back to what we were discussing. And be prepared. The best way to prepare is probably with a simple list of questions. An unstructured guide. Your goal here is not to ask them everything about everything. You want to know what's sort of on their minds. It's a more organic process, in a sense, than the survey design. You don't want to give them your survey instrument unless you're specifically asking them to react to feedback on your survey. But you could bring your list of domains and ask them a question about each domain. That would be one way of sort of making sure you've covered what you think you need to cover. When your group is over, you need to summarize what you've received from people. You want to ask questions like, do they understand the key concepts? Do they think about the topic the way you do? Or do you really need to rethink how you're asking questions in order to get at that goal that you're trying to get to at the end? Remember from the survey lecture, I said start at the end. Think about the end and say, okay, if I go down the path I'm going, will people understand them in the way I think they're understanding them? And then did anything surprise you? And you can learn a lot from that. And you can revise your domains based on these things that you've learned. So again, this is a very quick introduction. I'm happy to talk to you individually about your focus groups, and have fun.